initial dissection on the ruminant, and we're working on a goat here. So there's our distant view, and now we've skinned everything pretty well down to the part of the brachium, and actually part of the antebrachium there. But we're looking now at the muscles of the neck, and they're hard to tell the differentiate. We'll roughly approximate where they are right now. You can see the trapezius and all that's the extent of the trapezius. Brachiocephalicus and omotransversarius are all of that. Now the omotransversarius is supposed to be up a little bit separate, but it's hard to see at this point exactly where that is. You can see the deltoideus. So, okay, deltoideus. The supraspinatus and infraspinatus are kind of covered by things, but roughly that's where they would be. And then we move downward, you can see the long head of the triceps, the lateral head of the triceps. Down here things get pretty murky. We really don't have them separated out well, but roughly you can see the extensor carpi radialis there. It looks like it may even have another head here in this goat. And then there's the common digital extensor and the lateral digital extensor. And then we have the ulnaris lateralis, and then there is an ulnar head of the deep digital flexor tendon right there. One quick thing now, it looks like we have at least partially separated out the omotransversarius and the rest of the brachiocephalicus. You can see sort of a division right there. So omotransversarius is where? That's, yeah, where the scalpel is under. And then the brachiocephalicus would be the rest of it. Also, we do have, it looks like maybe part of what appears to be C2 here. There's a, yeah, so that's just part of that coli branch of C2 there. So we've sort of peeled back that omotransversarius. The upper part there is part of the trapezius that we've kind of reflected. We haven't actually cut the omotransversarius, but kind of got it out of the way. There's a big old fat pad right in this area. And we've removed part of that fat pad, checking to make sure there wasn't a lymph node, and there wasn't. So we started just slicing down through it, and we cut right through the lymph node. Can we get that exposed just a little more there, just to show that it's right in there? So you see the brown color, that's the lymph node, superficial cervical lymph nodes. So in ruminants, as opposed to the horse, the lymph nodes are usually big. They aren't tiny little small ones that are all together. Looking at the sternocephalicus muscle now, you see the jugular vein has been cut. Sternocephalicus can be divided into two bellies. The one is the sternomandibularis, which is the more superficial part here, and then a little deeper to that, and actually looking to form part of the floor of maybe the jugular furrow, is the sternomastoideus. So that's that, yeah, that belly right there. Now also, the brachiocephalicus can theoretically be divided into a clitomastoideus, and that may form part of that floor also, and then a occipitalis, which would be going up there. We are sort of, yeah, if I could kind of just get ahead a little bit of a, we've cut the sternocephalicus, reflected it, and you see some thymus showing up through here. Now, thymus is a little tricky. When you first look at it, it looks almost like muscle, so, but that is thymus. And now we have located we've dug down sort of in there and isolated the common carotid artery and the carotid sheath, and you see the vagosympathetic trunk is quite huge. On the left side, which this is, the esophagus, which is all of that, tends to separate this common carotid and vagosympathetic trunk from the recurrent laryngeal, which tends to be on the trachea often, and then also the internal jugular that's supposedly running along with that over there. So this is we're starting another session on the we'll do the week that'll be the first full week of dissection on ruminants, and we've already done quite a bit. We removed the eye, looked at the structures of the eye, we talked about the teeth, the sinuses. Now we're starting on the head. We've skinned the head, and we'll just go over some of these terms quickly. Some of these are a little deeper, so we can't really talk about the parotid auricularis muscle. Would be right there. Let's see if I can get enough contrast here to see that. And then the frontalis, the orbicularis oculi frontalis is over there. Good. Can you do that again? I don't think I got. There we go. Frontalis. The orbicularis oculi just goes around the eye. We have the malaris. Malaris is just a little thin, and the goat here, at least, is pretty thin. It's just coming down from the eye. It's pretty superficial. The zygomaticus, and the goat is fairly thick here, but that's the zygomaticus. And then the it doesn't tell us to find it, but let's point out the levator nasolabialis. We have it there. All right, so then we find we've followed the I don't know why this. Oh, there we go. The jugular vein, and you can see where it's branching into linguofacial there and maxillary. And we've reflected the sternomandibularis muscle there. Now we're looking down at the parotid, and the parotid is about the same as it was in the horse. It goes down. It's a little hard to distinguish it from mandibular, but the mandibular, especially in this goat, is a lot different. See how far caudally that mandibular celebrates, running below the jugular vein there, actually. And it looks like muscle. And then here's the mandibular lymph node. So you can see it's close to the mandibular salivary gland. It's a lot different than it was in a horse. And also, if you look caudal to this parotid gland, you can see mandibular gland deep to it. I think I saw that a little bit ago. Back, that was on the illustration that was shown. We haven't really opened that up yet at this point. Here that's very strange and different about goats. I think goats are the only species in which this happens, but sternomandibularis, instead of its usual attachment, is going all the way up. The tendon is running the muscle to the zygomatic arch. The lab guide tells one to follow that linguofacial vein until it becomes the facial vein, so that would mean at the point where the lingual vein comes off. And it's down underneath it, so it's kind of down below it there, and you can see it right there. That would be the lingual vein. Now we're looking at we've done extensive dissections, even though it doesn't tell one to really do all this in the lab guide. The one way to find this stuff is to follow. First of all, you notice the transverse facial artery, and then running close to that is the dorsal buccal branch of the facial nerve. The auriculotemporal nerve would be close to that. I don't really know if we found the auriculotemporal per se, but it would be running with that. Then if we follow this transverse facial artery back, and you can actually now see the facial nerve down here. That's the facial nerve, see, and then you can see the auriculopalpebral branch coming up from the facial nerve, and then the superficial temporal artery is that artery running up here. Follow it all the way up. It takes a lot of dissection to go all the way up here to the temporal line roughly, and then if you look carefully, then there's a little branch heading back toward about where the horn is, and that's the cornual branch. Here, after much dissection, we have followed we're looking for, first of all, the angularis oculi vein, which is just a vein now. It loses latex, so it doesn't have much latex in it, but it's a pretty prominent vein in this area. Now, the angularis oculi artery is close to that, but it's coming off of the transverse facial, and it's a little deeper, so you have to dig down a little bit to find that. The supraorbital was hard. It really is difficult to find out. In the goat, according to the atlas, the foramen is more toward the lateral canthus and the more little rostrally place than what we're used to seeing it. And that's about where it should be. We should find the artery and vein in that area. So upon further inspection, it looks like we have actually located, in this case, it actually doesn't tell them to do that in a lab, to you to do that in a lab guide, but here you can see the facial nerve. See how distinct that is coming up there. And then in this case, we can actually see the auriculotemporal nerve coming in and running down and communicating with that dorsal buccal branch of the facial. Now we're looking for the lateral retropharyngeal lymph node, aka lentil, and basically it's above the jugular vein. So you go a little ways above the jugular vein, and then you go below the wing of the atlas. You can palpate right there is the wing of the atlas. And then you just start cutting through that tissue right there, and down in there should be a large lymph node. That is the lateral retropharyngeal lymph node, which is a terminal lymph node in the case of the ruminants. We earlier located the ventral buccal branch coming around here underneath this in the facial impression here. And